Welcome to this explainer. Today, we're diving into some really fantastic insights from Everblink Health Care, and we're unpacking something that sits at the absolute heart of medical care. Yet, honestly, it often goes completely unnoticed. We are talking about how clear, straightforward communication can drastically improve patient outcomes.
Let's just kick things off with a simple but super profound question. What if the biggest barrier to better health isn't a lack of treatment, but a lack of understanding? It's kind of a wake-up call, right? As the source material points out, a prescription is literally only helpful if a patient actually knows how to take it. A diagnosis only empowers someone if they actually understand what it means for their body. Frankly, it just doesn't matter how incredible or cutting-edge the medical intervention is if the message gets completely lost in translation.
So here is our roadmap for today's explainer. We're going to hit 6 key areas: the hidden healthcare barrier, defining health literacy, why plain language matters, 5 practical communication strategies, common mistakes to avoid, and finally, a shared healthcare responsibility.
Okay, starting with part 1, the hidden healthcare barrier, an invisible wall.
There is this really fascinating paradox going on right now. As medicine becomes increasingly advanced, our communication actually needs to become simpler, not more complicated. For healthcare pros, researchers, and medical writers, the source material is very clear. Using plain language is absolutely not about dumbing down the science, not at all. It is entirely about making that highly accurate information understandable, actionable, and meaningful for every single patient that walks through the door.
Moving right along to section 2, defining health literacy. What does it mean? Let's nail down what this concept actually looks like in the real world.
Health literacy is basically a person's ability to find, understand, and use health information to make informed decisions about their care. And the crucial word there is use. This is way beyond basic reading comprehension. It's the fundamental, everyday skill of navigating your own healthcare journey.
So we are talking about way more than just skimming a pamphlet in a waiting room. Imagine trying to decipher a tiny medication label at 2 a.m. when you're completely exhausted, or trying to make sense of a really dense 10-page consent form right before you go into surgery. Health literacy touches all of these things, from complex diagnostic reports to simple lifestyle recommendations. And when patients struggle with this stuff, the source notes they're significantly more likely to miss medications, delay their treatments, misunderstand their own diagnoses, or experience complications that were totally preventable.
Which brings us to section 3. Why plain language matters. Simplifying communication. This is where we shift the paradigm. Plain language is the solution because it removes unnecessary complexity while carefully preserving the exact medical accuracy we need.
Let's look at just how simple this can actually be. Instead of using the clinical term hypertension, you just say high blood pressure. Look, healthcare professionals spend years and years mastering medical terminology, but patients definitely do not. Using high blood pressure preserves the exact same medical meaning and scientific accuracy as hypertension, but it completely obliterates the jargon barrier.
Here is another brilliant example. Instead of writing, administer orally twice daily, which, let's be honest, sounds like it's straight out of a textbook, simply saying, take this medicine by mouth 2 times a day bridges the gap perfectly. It's a real light bulb moment for communication. It takes what a doctor studies for years in medical school and translates it into exactly what a patient needs to know right now, standing in their own kitchen.
And let's look at one more quick win. Just swapping adverse effects for possible side effects. Small, tiny changes like these are incredibly powerful. They drastically improve understanding without ever altering the core message. And get this, studies actually show that simple phrasing tweaks like this can increase a patient's adherence to a treatment plan by a massive margin.
So what is the ultimate payoff here? Well, when patients actually understand their health info, the tangible outcomes are just remarkable. They're way more likely to follow treatment plans correctly, take their medications exactly as prescribed, and actually show up to their follow-up appointments. They recognize warning signs earlier. Plus, they feel confident asking questions and actively participating in shared decision-making. Everblink Health Care points out that research consistently shows effective communication strengthens trust. In fact, in many situations, this level of crystal-clear communication is just as valuable as the latest million-dollar medical technology.
All right, section 4. 5 practical communication strategies. Improving communication. We know why it matters, so let's dive into the tactical playbook for how we actually pull this off in everyday clinical practice.
The source material lays out 5 very clear, practical steps. First up, replace medical jargon with everyday words. Second, organize the info clearly.
Third, focus on the most important messages, because honestly, patients rarely remember everything discussed in a quick 15-minute visit. So highlight those main takeaways right out of the gate, maybe even use a simple checklist. Fourth, encourage questions. And finally, step 5, confirm understanding. Let's look a bit closer at a couple of these.
Zooming in on organizing clearly. Patients remember information so much better when it follows a simple, logical flow rather than just getting hit with a massive wave of data all at once. Think of it like this: what is happening, why does it matter, and what should I do next? It is a highly structured, super digestible way to guide someone through an appointment without overwhelming them.
Now let's talk about encouraging questions. Pay attention to the subtle difference in approach here. Asking, "Do you understand?" is a closed question. It almost always invites a polite, very hesitant yes, even if the patient is completely lost. But if you change that to, "What questions do you have?" you actively open the floor. You create a welcoming vibe that actually encourages a meaningful conversation rather than just a knee-jerk yes or no reflex.
And for confirming understanding, Everblink highlights an absolute game changer: the teach-back approach. It's so simple, but so effective. After you explain something important, you just ask the patient to describe it back to you in their own words. Boom! It identifies any misunderstandings right there in the room while actively reinforcing what they just learned. It completely takes the guesswork out of the equation for everyone involved.
Moving on to Section 5, Common Mistakes to Avoid, Communication Pitfalls. Let's pivot and look at the classic blunders even highly experienced professionals make.
You know, it is surprisingly easy to unintentionally build massive walls between you and the patient. This happens when we use unexplained abbreviations or when we firehose patients with way too much information all at once. It also happens when we just assume they already know basic medical terminology, or when we hand over instructions without actually checking if they get it. Another huge one is writing educational materials at an unnecessarily advanced reading level. Recognizing these specific pitfalls is literally the vital first step toward true patient-centered communication. And that brings us to our final section: a shared healthcare responsibility beyond the clinic. Let's zoom out and look at the bigger picture here.
Health literacy is absolutely not just the patient's responsibility. It is a team sport that extends far beyond the hospital walls. Plain language has to be baked into patient education materials, public health campaigns, medical websites, clinical trial documents, social media content, healthcare newsletters, the whole shebang. Whether you are a clinician, an educator, a researcher, or a medical writer, the goal is exactly the same: communicate clearly without compromising the science. Strong medical communication is the literal bridge between clinical evidence and actual human understanding.
So the grand takeaway is this: when information is actually easy to understand, the entire dynamic shifts. Patients go from being passive recipients of instructions to active co-pilots in their own healthcare journey. And that is an incredible shift that benefits absolutely everyone involved in the healthcare system.
I want to leave you with this powerful, paradigm-shifting quote from Everblink Health Care that pretty much perfectly summarizes everything we've talked about today. Plain language does not reduce professionalism, it enhances it. Medicine is evolving at a breakneck pace, but the fundamental principle that patients deserve information they can actually understand, that remains constant.
And that leads us to our final provocative thought for you today. How will you change your communication habits today to ensure your patients truly understand? Whether it's choosing simpler words, structuring your conversations more logically, or trying out that teach-back method, health literacy is all about making healthcare more effective, inclusive, and compassionate. Thanks so much for joining me to explore this incredibly vital topic. Now go out there and communicate clearly.